Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Jen is a 31-year-old female who presents for care complaining of depressed mood. During the interview, it becomes apparent that she has a long history of depressive symptoms, as well as a long history of being socially isolated and feeling generally inadequate. When considering a diagnosis of persistent depressive disorder, the psych mental health nurse practitioner considers that the core concept of persistent depressive disorder refers to subaffective or subclinical depressive disorder with all of the following except: A, low-grade chronicity for at least 2 years, B, insidious onset, usually in childhood or adolescence, C, strong family history of depressive and bipolar disorder, or D, long asymptomatic periods between episodes. So what we're looking for here is the exception. And, keeping in mind that this may have been described to you as dysthymic disorder, this is the DSM-5 terminology for what we used to call dysthymic disorder. We now call it persistent depressive disorder. Other than the change in name, all of the issues and criteria are essentially the same as they have always been. And so persistent depressive disorder, aka dysthymia, really is distinctly different from a major depressive episode or major depressive disorder recurrent in one particularly significant way. So as we look at the question here, let's look again at the question and the answer choices. The PMHNP considers that the core concept of persistent depressive disorder refers to subaffective or subclinical depressive disorder with all of the following except. What's the exception? What's the thing that we don't see in persistent depressive disorder? Low-grade chronicity for at least 2 years, insidious onset, usually in childhood or adolescence, strong family history of depression and bipolar disorder, or long asymptomatic periods between episodes. The exception, the correct answer here is D. D is the exception. Persistent depressive disorder is characterized by its chronicity, and so by definition, there is not any long asymptomatic period between episodes. Now, this is not like a major depressive disorder, where in major depressive disorder, there are distinctly periods of normal mood between the major depressive episodes. So it's a key feature, it's a key difference between the two. Persistent depressive disorder is not characterized by long asymptomatic periods between episodes. And this is one of the key features of diagnoses. Otherwise, there is at a very minimum a 2-year history, and most of the time this onset is really insidious, virtually always there in childhood or adolescence. Now, that doesn't necessarily mean that the patient was diagnosed with it or the patient even received any sort of care for it. It's not at all unusual to have adults come in for care, and as they describe their symptoms to us and we probe into their history a bit, we find that they have been having symptoms for years and years and years. So the fact that she's 31 doesn't mean that this didn't start in childhood or adolescence. In fact, if it is persistent depressive disorder, then it probably did start in childhood or adolescence. This just might be the first time you're hearing about it. So again, persistent depressive disorder, no asymptomatic periods in between episodes, virtually always insidious onset, usually beginning in childhood or adolescence, and the family history of depression and bipolar disorder may or may not be there. A family history of these things absolutely support the diagnosis. They're not required for diagnosis, but they support it. So all of these are features to consider. But again, when you zoom in on exactly what the question is asking of you, the question says, You, the PMHNP, consider that the core concept of persistent depressive disorder refers to subaffective or subclinical depressive disorder with all of the following except. What's the exception with this disorder? And the exception is D, long asymptomatic periods between episodes.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.